Welcome to Viva Codes. So today let's see what are all the different types of coding available in medical coding. So it is very much important if you are going to start a career with medical coding, we need to know what are all the coding types available in medical coding so that you can land on a coding which you are really interested into, right? So first let us see without further delay what are all the types of coding. Okay, so the very first thing is HCPCS coding. So this HCPCS coding is nothing but healthcare common procedural coding system. Okay, this HCPCS is in turn divided into two types, that is level 1 and level 2 coding. What is this level 1 and level 2? It is nothing but what we are taking from the chart is what we call it as the level 1 and level 2. Okay, fine. If suppose the patient is coming to outpatient, means for example, let us say dialysis. Okay, so the patient has CKD, which is chronic kidney disease. Further, the patient is under dialysis. Now this patient is coming to hospital as outpatient, and this patient is coming in wheelchair. Okay, so now this level 1 and level 2, how it is going to act? The level in the level 1, I am going to take the outpatient procedural code, means the patient has come for dialysis, right? So I am going to take the level 1 as dialysis procedure code. Okay, that is only level 1 code. Whereas what is level 2 then? The patient is coming in wheelchair. So those kind of equipments, medical supplies, all those kind of things will fall under level 2, because we need to pay for everything, for the services they provide, for the equipments they provide, everything. Okay, so for the patient who is coming in wheelchair to OP for the dialysis, which is for CKD, you need to capture level 1 as the procedure, which is the dialysis, whereas level 2 is for the wheelchair, which is the equipment the patient is using in the hospital. Okay, so this is all about HCPCS, Healthcare Common Procedural Coding System. Fine. So now one more type of coding is that ICD-10-CM. Okay, what is this ICD-10-CM? It is International Classification of Diseases. 10 stands for 10th revision and CM stands for clinical modification. So this code is used to capture the diagnosis code. Diagnosis code is nothing but the disease conditions which the patient has. So let it be of inpatient or outpatient. When a patient has a condition, like if a person has a condition only, he'll come to hospital, right? So this ICD-10-CM is useful in both IP and OP. Okay, so what are the diseases we'll see in OP? Basically, if the patient is having a chronic condition. What is chronic condition? A lifelong. If the patient is having, for example, if the patient is diagnosed with hypertension, GERD, and sometimes diabetes, all these conditions are considered as chronic, means long-term conditions. If the patient once is diagnosed with these kind of condition, lifelong he'll be under medications. Okay, that is what we call it as chronic or long-term condition. So that kind of conditions we'll go for the OP. We don't get admitted, right? We'll go to the provider's clinic, we'll get some medicines or some prescriptions from the provider, and then we will leave the hospital. We won't stay in the hospital, right? So those kind of conditions which are chronic and does not need an IP stay is what we consider as an OP codes, and mostly it will be chronic. So what about the IP? So for these codes includes the acute conditions and acute life-threatening condition. What is the difference between acute and acute life-threatening condition? Simple. For example, if the patient is having this acute, means short-term condition, suddenly it comes and it will live for a very short term and it will go. For example, the patient is having UTI, acute pancreatitis, appendicitis. Okay, PNA means pneumonia. All these conditions are acute, that is short term conditions. Okay, because These conditions come suddenly and they will go after a period of time if treated in a proper way. See, for example, UTI. UTI is a urinary tract infection where the urinary bladder, the the place where the urine gets hold, right, it's stored, those places it will get infected with the infection. Okay, so for this they will be provided us with the antibiotics. So if we are like prescribed for 2 weeks, no, these UTI will get cured. So that is what we call it as acute, that is short term conditions. What is acute life threatening condition? For example, if the UTI is left untreated, no, this UTI will lead to sepsis, which is a systemic infection, means it will spread through blood all over the body. So this UTI, if left untreated, no, it leads to sepsis, which is a life threatening. This is also acute, but it is a life threatening. Means what? Means if some conditions, though it is acute, if not treated also, it won't be that much fatal to the patient. Whereas certain life threatening conditions, if it is not treated, it will lead to the fatality, that is the, it will lead to death of the patient. Such conditions are called as acute life threatening conditions. Example is that sepsis, CVA or stroke, myocardial infarction. All these conditions needs an immediate medical attention once diagnosed. Okay, so third type is that ICD-10 PCS codes. What is this ICD-10 PCS code? It is, PCS stands for Procedural Coding System. Okay. So initially we saw the procedures which are done in the outpatients are captured with the help of CPT coding. Whereas in this, the procedures which are done in the inpatient are captured in ICD-10 PCS. This is what the major difference. Okay, so let me explain you with an example so that you will be even more clear. Okay, so now see, here is an example which shows, it's a continuous example. From this, let me tell you what are all the codes we need to take. Okay, like it's like a story. For example, if the patient in an OP ward, imagine in an OP ward, the patient is coming for ESRD. ESRD means end stage renal disease. Okay, so for that end stage renal disease, the patient is undergoing dialysis regularly. He comes to OP ward every Monday, Wednesday, Friday. Okay, this is actually MWF. Okay, weekly thrice he will undergo dialysis and goes to his home. Now the patient is coming to hospital in wheelchair. Okay, let us assume like that. Now the thing is, what all the codes we'll be taking from here is, see, outpatient coding scenario. If this is the scenario, what are all the codes you will take? So first I will go with the diagnosis, ICD-10-CM, which is the condition ESRD. So I'm taking the code for ESRD. Next, I will take the procedure for ESRD as CPT code. That procedure is nothing but the dialysis which is done for the ESRD. So I'm going to take code for the dialysis in outpatient as OP procedure, CPT coding. So the remaining is the patient is coming in wheelchair, means for that wheelchair I'll take the HCPCS level 2 coding wheelchair, which goes for the equipment billing. Okay, so this is what, how we take the code in the CPT. If you are going to work in CPT, you will deal with diagnosis coding, CPT coding, which is outpatient procedure coding, and also HCPCS. Okay, HCPCS is the equipments used. That is not generally HCPCS. HCPCS level 2 deals with the equipments. Okay, so means in short, the combo of these three is OP coding. Okay, so now next one is that inpatient coding scenario. For that, let us see the question first. In the inpatient ward, okay, now the same patient, okay, after a month is getting admitted to an inpatient ward. For what? Now the patient gets admitted for fluid overload due to non-compliance with dialysis. Okay, admit to IP, continue RRT. RRT is nothing but renal replacement therapy. Renal replacement therapy means it could be hemodialysis, peritoneal dialysis, or hemofiltration. Any type of procedure which is going to purify our blood, okay, and like separate the urine. Okay, It doesn't allow to stay inside our body. That is called renal replacement therapy. Okay. Now, why this patient is getting admitted to the hospital? The patient gets admitted for fluid overload due to non-compliance with the dialysis. Means the patient is having ESRD for which he was taking dialysis Monday, Wednesday, Friday. Suddenly, he was not taking dialysis for 2 weeks, let's assume. Okay. What happens means only because of dialysis, he is under normal condition. Once he has stopped the dialysis, non-compliance means he is not compliant, he is not regular with the treatment. Okay, what happens means the fluid will start getting accumulated in all our cavities. Okay, for example, it will be getting accumulated in the, like in the around the heart, the fluids wherever it has the cavities, it will go and get fluid gets deposited, because the fluid which need to be excreted out through dialysis, when once the patient had stopped taking it, had resulted in fluid overload. Means overload means high load. Okay, so it's like it's not fair, it's like worsening of the condition. Okay, so now that is the reason the patient is getting admitted to IP. There the patient is undergoing RRT. Now how to score the scenario in IP? Very easy. Okay, see, this is the question. Inpatient coding scenario is, see, this is the question. And here, as usual, first we need to take the diagnosis. That is the ICD-10-CM. What are all the diagnosis? In the OP, it was just the ESRD. Now, since the patient was non-compliant with dialysis, the ESRD has, like the ESRD has been worsened with the condition called fluid overload. Okay, so the conditions which we need to take in IP is ESRD, fluid overload, non-compliance with dialysis, for which we'll have a Z series code. Okay, non-compliance. Since the patient is not compliant with the dialysis only, he got fluid overload, right? So we need to specify that. So all these three codes will come under ICD-10-CM. Next, ICD-10-PCS, which I have already told you, it is a coding which takes the procedures which are performed in the IP. What is the procedure performed here in the IP? It is nothing but they have given us continue renal replacement therapy. So they are doing one of the renal replacement therapy. It could be either hemodialysis, peritoneal dialysis, or hemofiltration. Depending on what they are doing, we should take the PCS coding for that. Okay, so now the combo of ICD-10-CM and ICD-10-PCS is what we call it as IPDRG, that is inpatient diagnosis related group. Okay, yeah, this is what we call it as types of coding. So in short, if I'm going to say what all I have taught you, there are coding, basically there are outpatient and inpatient coding. For the outpatient coding, we will include the CPT coding, which is used to take the outpatient procedure, and HCPCS level 2 coding, which is used for the supplies and equipments which are used in the outpatient, and ICD-10-CM, which is a diagnosis coding. Whereas when it comes to IP, we will once again go with the ICD-10-CM, also ICD-10-PCS. So combo of 3 is what we call it as OP coding. Combo of 2 is what we call it as IP coding. See, this is what the exact scenario of what we are going to work into. If you are interested into OP, you should be okay with all these types of coding. If you are interested in IP, we should be okay with ICD-10-CM and ICD-10-PCS. Okay, so let us meet in next video. Happy coding.